Good day, and welcome to FYI. I'm your host, John Baillie, and today we're going to be talking about insurance. It seems that insurance, especially healthcare insurance, is a topic of conversation, whether it has something to do with the current administration or insurance companies changing their rules and regulations. Healthcare insurance is very, very important to our lifestyle, our life, and our family. And with me today is the gentleman who owns Thousand Oaks Insurance Agency, Pat Node. Welcome, Pat.
Thank you, John. It's great to be here.
Now, Pat, you own this agency.
I do.
How long have you owned it?
Since 1997.
And you are an independent
Agent, which means when people come to us, we can offer them a choice from many different companies rather than just one.
Now, I understand you majored in economics when you were in college.
Yes, University of California, economics major.
Why did you pick economics?
I just found it to be fascinating studying the economy and what administrative, political, economic forces bring to bear on a host of different subjects, such as insurance and investments. And I wasn't exactly sure which area I wanted to go into, so I thought economics was a broad degree that applied to many different things. If I wanted to go to law school or go into business or go into the public sector or private sector, it had a lot of different things that were applicable, so I thought it was a good way to go.
Well, I have to tell you, I really took economics, and I didn't like it. I just learned what G and P meant, but I tell you, I really didn't enjoy economics at all. It's a very difficult subject.
It's difficult, but a lot of it depends on the professor, the teacher, like many things, the messenger. So I was lucky enough to have some excellent professors, which sparked my passion for it.
Well, the interesting thing is I took business and I took marketing, I took advertising, and I guess that suits me. But what you're saying to me, because you're an economic major, you really have to be in touch with what's going on every day in the business community to help your business and your clients.
It's true. I mean, there's insurance products are made to be very simplistic. If we watch all the advertising that we see on TV or hear on the radio, it's made to be very simplistic and to do pretty much with price if you believe everything you hear on TV. But there's a lot more to it than that. And that's what I like, and I encourage people to work with a professional agent so we bring that professional knowledge and help them out. Our agency logo is Trusted Advisor, so we try to be a trusted advisor to everybody we talk to. We educate them on the complexities of what their risks are and how to match an insurance product to help mitigate the risk in their everyday life.
So today, with Obamacare and the way the healthcare insurance business is going, it's kind of complicated.
It's very complicated. There's some good and bad, as with anything. And there's always some anxiety when there's major changes like we've experienced over the last few years. The good news is if you're on a limited income and you're at under 400% of the federal poverty level, you can get assistance in paying your insurance premiums from the government. The flip side of that is it is a little bit difficult to get that subsidy approved and issued. You have to submit tax returns, income documents, so the administrative side of it can be a little cumbersome.
Well, the other interesting thing is that my wife works for two doctors, and they are now on their fourth or fifth generation of patients. And these people have been going to these doctors for a long time, and they're coming in right now, and the doctors won't see them.
Right.
Because they're not part of that insurance program that are going to pay the doctors. I know a gentleman who is a chief financial officer, and he is ecstatic about Obamacare. And the reason being is they're paying out less money for health care insurance for their employees than they did a year ago.
Well, there's no free lunch, as with anything. So how they're trying to, quote, bend the cost curve down and make things more affordable is they're trying to pay providers, hospital networks, doctors, physicians less money for their product. Well, the flip side of that is that there are certain doctors that are now choosing not to accept insurance, because if you go into them, for instance, for a broken arm, they in the past have chosen to charge, let's say, $300 for that. The insurance companies are now saying, we'll pay you $150 for that. Well, under their current business model, some of them cannot survive under that.
Correct.
So we're getting pushback, and some physicians that are more established are choosing not to accept insurance anymore. So it's become more and more of a consumer-driven health insurance marketplace. And what I mean by that is consumers are now being forced to inject themselves into the marketplace and shop for the best deal on getting service for a broken arm, for a back issue. Pick your ailment that you're going to get treated for. Consumers are now having to shop for the best provider rather than the insurance company would have done that in the past. So it's really put the onus back onto the John Q. public now to shop for their not only their health insurance, but for their provider as well.
Well, it's kind of interesting. As I said, my wife works for 2 orthopedic doctors, and sometimes the insurance company will only approve enough money just to take care of the supplies.
Right.
And there's nothing left. I mean, to cover the heat and light and bricks and mortar and salaries and all this, that, and the other thing. And so they have to turn around and say to these patients, sorry, we can't help you. And they can't. Now, when a patient comes to you and they're looking at getting health care insurance, and you just said you try to help them shop around
Correct.
for the right policy, healthcare policy. How do you do that?
Well, we have software that we use. We take some information, some basic information, their name and their residential area they live in, and also what their budget is, because we have a host of different companies. And let me just mention, too, when people are shopping for health insurance, you don't pay anything more to use an agent to help you as your advocate. You can get on the phone and speak with an agent directly with these companies, or you can speak with an agent like me or your own agent to shop for the health insurance for you. But what I do is I look for the best match between what the customer's budget and their healthcare needs are. And then I provide some options for them. For instance, some people love Kaiser. They love that model. Other people want to stay away from an HMO model, so we look for PPOs where they can choose their own doctor. So it really depends on what those unique needs are for the person, both from a budget as well as a healthcare standpoint. The other change that is good is there's a once-a-year open enrollment now for everybody. So if you're on a plan that you don't necessarily like, you can change that once a year. You make that election in December for the January 1st of the following year.
Do you really believe that everybody understands the current healthcare insurance situation we're in today with Obamacare?
Well, the reason I giggle a little bit is because even agents that have gone through hours and hours of training, and I've been selling not only individual and Medicare supplement and business group plans for years, the rules have been changed so frequently that it's very, very difficult, even for a professional agent, to stay on top of the current rules. So I imagine there are some people that have a good understanding of it, but I would say the majority of the people really don't know until they have a claim, until they have a serious medical condition, and they go to have treatment and they start receiving these large bills in the mail that their insurance aren't paying for. So that's when the agent really shines, is when they can help a client point out these areas where there could be deficiencies if they experience a major claim.
It's amazing because my wife is always telling me war stories, because she has to do several times a day go and get approvals for an insurance company to cover a patient's cost.
Right.
And then she'll pick up the phone and she'll call that patient and she'll say, I can't get approval. Your insurance company will not approve your visit. And the patient gets very, very disturbed.
Right.
Angry. Mm-hmm. And you don't know what you're doing and all this, that, and the other thing. And my wife turns around and say, please call your insurance company or your agent and you ask them.
Well, that's a great point, John. And we always encourage people whenever they're going to get treatment for anything other than just a routine physical, always, always, always call your health insurance company and get pre-approval. You don't need to do that if you're going in for a cold or an annual checkup. But if you're going in for a surgery, you need to make sure, and you need to be proactive, not only in calling the insurance company to make sure it's covered, but more importantly, make sure that every provider that's going to touch you and work on you is in your network. So we've had examples of people that have gone in to get treatment and their doctor is covered by the network, but maybe the anesthesiologist is not. So they get a bill from an anesthesiologist that's covered at a network, and maybe the insurance will only pay 50% of that. So they're faced with thousands of dollars of out-of-pocket costs. So that's what I go back to consumer-driven health insurance. The onus is really now on everybody to do the due diligence and check.
I've heard some people say with Obamacare their deductible is now $5,000.
It's true. There's different metal tiers of plans now. On the lowest level, there's bronze. The next level up is silver, gold, and platinum. So, for instance, the least expensive plans are bronze level plans, and those plans come with a deductible of up to $5,000, $6,000, $7,000.
That's a lot of money.
It's a lot of money. Each year, you need to make a decision based on your anticipation of utilization of the plan. Now, what do I mean by that? If you know you're going to need a surgery in the coming year, you need to select a plan with a lower deductible and a corresponding. It's going to have a higher premium. But I, as your agent, can help make that determination based on what surgery you're going to have. So if it's going to be a $20,000 surgery, we need to look at which plan matches best, not only from a cost, but out-of-pocket cost.
Well, you know, it's the other thing is people were basically given the option of Obamacare or no Obamacare.
Right.
They had no choice.
Correct.
It was this or that. And sometimes I think that's not fair, because that doesn't give us the freedom of choosing what we want for what we got.
Correct.
Meaning, if I've got a healthcare policy and I'm happy with it and it's working for my doctor, you know, why would I want to change? And that has never made any sense to me.
Right. There are certain things they made mandatory, like maternity benefits. Well, if you're 50, 60 years old, you don't need a maternity benefit. Pediatric dental is now required as part of each plan. It's not something that everybody needs. So there's certain things that were mandated as part of Obamacare that don't make a lot of sense. I think the pendulum has swung so far on the other side that I think it's going to be a business cycle that eventually Obamacare will either be repealed or probably more likely be massaged and corrected and modified over the years. And I think some of these things will probably get eliminated and corrected.
I don't know if you can answer this, but are insurance companies happy with Obamacare, or is it a problem for them?
Well, they love the fact that everybody has to have health insurance now, because now they have thousands more customers. The other side is that the administration is now required that they pay out at least 90% of every dollar they collect for health insurance care and administrative costs. So it's really squeezing their bottom line, and we all know how insurance companies act. They're not going to absorb those costs. They're going to pass them on to us, and they're going to pass them on to paying the providers less.
So basically, the insurance companies had no choice either. It was basically, you do this.
Correct.
Obamacare or no Obamacare.
Correct.
And go forward. So they're basically struggling like the population of what's best for us, what's best for the patient.
That's right.
And sometimes it doesn't work out for them, it doesn't work out for the patient, and it doesn't work out for the doctors.
No, it doesn't. So it's as important as ever to get professional help if you're looking for a plan, not only from a budget standpoint, but also from a benefit standpoint, and just to go over all the little idiosyncrasies with the new system. It's really important that people seek out a professional.
Do you have a website?
I do. Our motto here at the agency is your trusted advisor. So our website is www.etrustedadvisor.com.
Can you give that to me again? My crayon broke. I got a bad crayon here today.
Sure, it's E as in Edward, Trusted Advisor. So www.etrustedadvisor.
And you have a phone number.
Area code 805, right here in Thousand Oaks, 805-480-2616.
Can you give that to me again?
805-480-2616. Or people can simply Google Thousand Oaks Insurance, and we should be one of the first one or two to come up.
And you are the owner of Thousand Oaks Insurance.
I am. I'm the proud owner. We have a staff here as well that all do a good job, and we're very passionate about the business because we just love helping people, and that's our passion. If we can't help you, we'll give you advice and send you along your way to another agent or company, but our motto is just that we're your trusted advisor, and whether we can help you or not, we're always here for you.
Well, it's obviously you're very busy because I'm interviewing you between 12 and 1, which is our lunchtime.
That's right.
It's the only time you could squeeze me in. I mean, so today we go without lunch, but I mean, this is the only time you had for an interview because you're so busy.
We are very busy, so it's a good problem to have, but business has been very good for us. Like I said, we're not a one-stop shop, so when you go out to shop for anything, you don't want to just look at one product. You want to look at multiple and make your own decision, and that's what we're able to do for people, whether they're looking for health insurance or auto, home, commercial, business insurance. We have multiple companies, and we're able to take very good care of people.
Well, Pat, I would like to thank you very much for taking the time during your lunch to have this little interview. And if anybody out there is having concerns with their healthcare insurance, have any area doubts, call Thousand Oaks Insurance Agency. Ask for Pat Note. He's a great guy, and he'll be able to help you in any direction you want to go, because health insurance is so important to everyone. Again, thanks, Pat.
It really is. And thank you, John. I appreciate it.
And thank you for listening, and I hope you have a great day. Stay well.